Today I will be discussing my theory on the onset of postpartum psychosis. The DSM-5 characterizes postpartum psychosis as brief psychotic disorder with an onset within 1 to 4 weeks of birth. However, it is largely recognized in the psychiatric community to be defined as postpartum psychosis if the onset is within 1 year of childbirth. Symptoms include the typical key symptoms of brief psychotic disorder, such as delusions, hallucinations, grandiose thinking or behavior, confusion, and mood swings. However, in the case of postpartum psychosis, symptoms can also unfortunately manifest in thoughts of harming yourself and/or your child or children. It is estimated that 1 to 2 out of every 1,000 mothers develop postpartum psychosis. Of these females, many have a personal or family history of bipolar disorder. However, up to 50% of people diagnosed with postpartum psychosis have no psychiatric history whatsoever, which can make this disorder especially tricky to understand. Currently, there is no true consensus within the research community as to the cause of postpartum psychosis. It has been cited in many cases that severe exhaustion was at play in the development of the disorder. Additionally, as we discussed, there is a link between pre-existing bipolar disorder and the development of postpartum psychosis, but not in all cases. It has also been largely agreed upon by researchers and clinicians that the drastic hormonal shift a female experiences when giving birth contributes to the onset of this specific form of brief psychotic disorder. Based on my research, I believe the best way to view the onset of postpartum psychosis is through a psychoneuroendocrine immunology framework. This model relies on the interplay between mental health, physiological factors such as neurochemicals and hormones, as well as genetic and environmental components. This framework outlines how 4 strong forces work both independently and interdependently to manifest postpartum psychosis. The components of this model can be broken down to illustrate the complex nature of this disorder. The first component in this model is the psychological aspects of the onset. These include a history with psychotic disorders, as well as many other psychological components that can contribute to brief psychotic disorder generally, such as past trauma, or specifically postpartum psychosis, such as distressing thoughts and feelings surrounding one's childbirth, especially if there were birthing complications or an especially challenging childbirth. The second component is the neurological component to the onset. This accounts for the neurochemical changes that can contribute to the onset of the disorder. Identical to brief psychotic disorder, it is likely that dopaminergic dysfunction can contribute to the onset. Third, there is an endocrine component to the onset of postpartum psychosis. The near-instant drastic depletion of pregnancy hormones after giving birth can have detrimental psychological effects. Females develop psychosis more often in the postpartum period than at any other time in their life. At one point, the endocrine component was seen as the sole reason for postpartum psychosis, but researchers now know this endocrine dysfunction is not always the cause, or at least the sole cause. The final component of this model is the immunology component. In recent years, it has been discovered that changes in the immune system which occur during pregnancy can cause inflammation which may impact the presentation of psychosis. Additionally, it has been found that bacteria in the gut may contribute to the onset of brief psychotic disorder more generally, which may be compounded by the profound changes someone experiences in their body after giving birth. I believe any circumstances in which infanticide or suicide are symptoms of a disorder, the onset and early detection of that disorder is of utmost importance. Currently, there is a vast lack of research on postpartum psychosis, as well as a blaring lack of educational resources for pregnant people and healthcare workers who treat postpartum patients. Ideally, if we are able to learn more about how this disorder develops and how it presents early on, we will be able to catch cases earlier at a much safer position in the progression of this disorder. And as this disorder gets progressively more severe with time, it often requires hospitalization to treat. And the quicker we can find a diagnosis, the sooner treatment can become available. It is also important to collectively familiarize ourselves with the onset of postpartum psychosis and the disorder more generally in order to support people experiencing this disorder. In our society, the narrative around childbirth hardly strays from the positive aspects of giving birth and early parenthood. This creates a situation in which people experiencing distressing thoughts around their birth or child often do not have an outlet to safely confide in. This is often also discussed by people who have experienced this disorder as an extremely isolating time, as they often do not feel comfortable confiding in their partners for fear that they will be seen as unfit to care for their children. People experiencing postpartum psychosis also often fear legal repercussions of admitting to considering infanticide, or that their child will be removed from their home. This effect may be magnified for people of color who are already at an increased risk of unfair incarceration in our country. It is also crucial to note that postpartum psychosis likely disproportionately affects people of low socioeconomic status. With low SES often comes working much later into a pregnancy, which can lead to extreme levels of physical and emotional exhaustion, which we know contributes to the onset of this disorder. Moving forward, it is crucial that more research is done to more solidly identify causes of postpartum psychosis in order to inform early detection and treatment. It is also crucial that we create a space in our society for people who do not have typical childbirth experiences to share their thoughts and receive appropriate help.